Hello there. Welcome to this episode of NAFDAC and Your Health. On this program, we provide you with insightful information about NAFDAC's activities aimed at safeguarding the health of the nation. My name is Okpejemi Urimolade. On today's episode of NAFDAC and Your Health, we bring you the strategic plan pillars of NAFDAC, which encompass all the programs and activities the agency lined up to ensure that the health of Nigerians is safeguarded. This was presented by the NAFDAC DG in a press conference at the agency's office complex in Isolo recently. For the past 7 years, NAFDAC has made great transformative strides that hitherto seemed unrealistic. The impact of NAFDAC as an agency responsible for curbing the availability of unwholesome food products as well as fake or expired drugs, cosmetics, chemicals, and medical devices in order to ensure that the health of Nigerians is safeguarded has been felt more than ever before in these years. This is due to the continuous, well-thought-out strategic plans that have become the norm since the inception of Professor Mojisola Adeyeye's headship of the regulatory agency. As the year 2025 begins, Professor Mojisola Adeyeye, in a press conference at the agency's Isolo office complex recently, reflected on the activities of the agency in the past years in order to work towards advancement.
Reflection on the past 7 years has brought into focus the many accomplishments that have been achieved in NAFDAC and so many others to be attained. This realization has sharpened my focus on how to strategically work towards continued strengthening of the regulatory system as a needed path towards safeguarding the health of the nation. In this bid, NAFDAC will continue to unlock the value chain through strengthening of the industry with focus on access to quality regulated products.
Professor Mojisola Adeyeye, in a characteristic manner, has worked out strategic plans that would help to further strengthen the regulatory system and consolidate on the landmark achievements of the past years. The NAFDAC DG reeled out these strategic plans, which she has methodically categorized under 5 pillars.
The first one is strong governance and leadership. This is to ensure the workforce stays highly motivated and disciplined. Our greatest need right now is adequate staff for all our regulatory activities at the headquarters, Lagos, and all NAFDAC formations in the 36 states plus FCT and Lagos. For the new year, the staff remuneration will be given adequate attention. In terms of our infrastructure, the plan includes completing the building of 10 state or zonal offices and laboratories, including the vaccines, biologics, and medical devices laboratory in Oshodi. We have many projects across the country. Our goal is to ensure that we finish 10 out of the structures that are already ongoing. To support our expanding activities and MSMEs, tools such as vehicles, computers, needed laboratory equipment will be procured. As part of reducing the cost of energy needed for our facilities, solar panels will be built into existing selected facilities. In NAFDAC, training is premium to us, for our staff. Therefore, more focus will be paid to staff in the 36 states especially to increase their competence in areas such as regulatory inspection, post-marketing surveillance for all our regulated products, safety monitoring, clinical trial and pharmacovigilance inspection, customer service, NAPAM's version 3, that is our e-registration platform. Communication is extremely important to NAFDAC. Publicity will focus more on issues such as mitigation of substandard falsified medicines, unwholesome foods, and we will have One Health approach to preventing antimicrobial resistance in terms of our communication. NAFDAC will also hold joint sensitization with respective sister agencies and health partners via different media, print, radio, TV, to ensure the public is adequately informed on regulated products and how to use them to improve healthy living. Our second pillar is institutionalization of best practices. For this, we plan to close any gap that we may have in maintaining our maturity level 3 and work towards achieving WHO listed authority status, that is called WLA, and also achieving ML4. This is to ensure that our regulated medical products are of quality, they are safe and efficacious. As part of our pathway to International Council on Harmonization membership, we plan to demonstrate implementation of ICH E6. This is Good Clinical Practice Guidelines, and ICH M13. This is about bioequivalence of regulated products or medicines.
The NAFDAC DG added that the Food Safety and Applied Nutrition Directorate will enhance the training and competence of staffers before she moved on to the third strategic plan.
This year, 2025, will be maternal, newborn, and child health and nutrition year. The focus is to prevent postpartum hemorrhage and maternal deaths drastically and reduce child morbidity. This will be achieved by ensuring the quality, safety, and efficacy of maternal health products such as oxytocin, tranexamic acid, carbetocin, and reducing falsification and substandard falsified medicines to less than 5%. Similarly, great emphasis will be placed on pediatric anti-malarials and antibiotics. Manufacturers of these products will be incentivized to develop pediatric medicines, and they will be handheld toward achieving WHO pre-qualification. Similarly, foods for malnourished children, ready-to-use therapeutic food, RUTF, will be adequately regulated, while the new soybean-based RUTF is supported through regulatory inspection and testing to ensure quality. The agency will increase the attention of our herbal medicines by seeking grants for clinical trials of already listed products. Collaboration with Nigerian Natural Medicine Development Agency, NNMDA, is being initiated. In the next 3 years, categories of listed products that will be considered for clinical trials include anti-malarials, sickle cell medicine, urinary tract medicines, diabetes, hypertension, arthritis, immune boosting, skin infections medicines.
The NAFDAC DG also spoke on the regulatory plans for cosmetics.
More training of stakeholders will take place every quarter to ensure understanding of cosmetics and the impact on health. A study of cosmetics made in Nigeria will be done and compared to imported cosmetics to know if there's a need to put some imported cosmetics under NAFDAC ceiling, while local manufacturing is encouraged. Our fourth strategic pillar is monitoring of the supply chain. The aims behind this strategic plan are to make regulated products moving within the country visible, to prevent diversion, to prevent infiltration, and prevent substandard falsified medicines or commodities in the supply chain, thus ensuring that public health is protected.
The plan on the GS1-driven monitoring of products along the supply chain, according to the NAFDAC DG, will also be extended in 2025.
The agency started good distribution and storage practice inspection in 2021 due to the pandemic that didn't allow for physical inspection. However, earlier in 2020, the agency introduced GS1-driven technology to monitoring of COVID-19 vaccines, and NAFDAC became the first agency to serialize vaccines that didn't come with barcodes. Since then, we have extended the monitoring of supply chain to non-COVID-19 vaccines, to anti-malarials, antiretrovirals, and anti-tuberculosis medicines. And these are medicines that are used by Global Fund. NAFDAC extended further the GS1-driven supply chain monitoring to private companies by monitoring narcotics as a class of drug for the pilot. In 2025, the agency will extend this monitoring to maternal, newborn, child health, and nutrition products to underscore the importance of making this class of products visible and protected from diversion, infiltration, and from or detecting substandard falsified medicine or unwholesome products. Solution providers that have been trained by GS1 company will be used, and the data will be annexed in the already established NAFDAC traceability information system.
The last pillar on the list of strategic plans for the year 2025 mentioned by the NAFDAC DG is efficient financial management.
NAFDAC wouldn't be where she is now without good financial management plan. The agency went from 3.2 billion debt inherited by my administration in 2017 to solvency. We are not owing anybody. And we did that within a year to wipe out that debt. Port Inspection Directorate was able to recover over 700 million naira of evaded payments. People will come with their consignment at the port and compromise, they will not pay. But we were able to recover 700 million in 2018. That is how we have been maintaining or keeping our financial system efficient. Since then, NAFDAC has continued to digitize its system to make the process transparent. The agency is now using SAP system to manage its finances, but internally, continued digitization is saving NAFDAC money by further plugging the holes from where money could have been oozing out. Based on the immensity of our regulatory activities, money is needed to increase staff strength, provide tools such as vehicles, laboratory equipment, computers, and to provide conducive work environment for our staff and for MSMEs in particular.
We'll take a short break now. Please stay tuned.
NAFDAC wishes to sensitize the general public on the detrimental effect of alcohol consumption by underage. Underage drinking can result in psychosocial and health problems like poor academic performance, increase in crime rate, alcohol dependency, mental health disorder, cardiovascular problems, kidney and liver diseases, and even death. NAFDAC advises parents and guardians to stop the exposure of young people below 18 to alcohol by asking them to sell or purchase it. For more enlightenment on NAFDAC activities, watch NAFDAC and Your Health program every Monday 6:30 p.m. to 7 p.m. on TVC and every Tuesday 8 p.m. to 8:30 p.m. on NTA. NAFDAC, safeguarding the health of the nation.
Welcome back. If you're just tuning in, you're watching NAFDAC in Your Health. The journalists at the press conference took turns to ask the NAFDAC DG questions, and the DG responded to the questions one after the other. A question was asked on the position of Nigeria on clinical trials for herbal concoctions.
I knew that herbal medicine is very effective, but many people might have died also because we don't know the quantity that should be taken. We say drink plentifully, 1 cup. We don't know the toxic components in that 1 cup. That is why clinical trials or a lot of research has to be done. However, NAFDAC is one of the few regulatory agencies in the world that have more structured means of approving herbal medicines, meaning that we have 2 stages of approving herbal medicines. When the practitioner submits to us, we go through all tests to ensure, including toxicity tests, to ensure that the product is safe. Bear in mind, these herbal medicines have been used by our forefathers and foremothers. However, we don't know whether it has caused a lot of harm in the past. But now, in today's NAFDAC, we run through a lot of tests. If we find it not to be toxic, we approve it for a limited time. We call it listed approval for 2 years. And what we expect practitioners to do is to now take it further for clinical trial. But without clinical trials, we cannot authoritatively say that it is safe or it can be used to treat. That is why on our listed labeling, we don't use words like to treat. We will not allow that. Or to cure. No. It's management until we get full details in terms of scientific data.
One of the journalists raised questions about the readiness of Nigeria for self-sufficiency in terms of drugs and medical device in case of an outbreak of epidemic like COVID-19.
In terms of medical devices, we have learned that we need to have local content. And the executive order of Mr. President is making that to happen. It's making what we started 2019 to now be implemented to the advantage of the local industry. That is part of the reason why we are now handholding our syringes manufacturers to ensure that if there is another pandemic, we will not be running helter-skelter. We now have 2 companies that make medical masks, and those 2 companies made those medical masks during the last pandemic. So there are many things that we are putting in place in terms of preparedness for another pandemic.
With the reeled out strategic plans, Nigerians can be assured that NAFDAC is prepared as always to ensure the health of the nation is safeguarded in 2025. That's all time permits us to take on this episode of the program. Please make it a date with us same time, same station, next week for another insightful episode. If you have comments, complaints, or you have reports about peddlers of fake drugs and adulterated food products, we are always available to listen to you.
You can reach NAFDAC via toll-free numbers. For inquiries, call 0700 162 3322. For complaints, call 0800 162 3322. You may also email NAFDAC at nafdac.gov.ng. If you have complaints about any form of misconduct, you can reach the Reforms Unit via email reforms@nafdac.gov.ng or call the Reforms hotlines on 0909 763 0506 or 0909 763 0507. NAFDAC, customer focused, agency minded.
Let's join hands to safeguard the health of Nigerians. See you again next week. Stay safe.